Welcome, I'm Dr. Melina Roberts, and I'm going to talk about a therapy that we offer within our clinic called Visceral Manipulation. Now, Visceral Manipulation was developed by a French osteopath named Dr. Jean-Pierre Burrell, and that's who I trained under. And it is a wonderful therapy. It's a gentle manual therapy that works quite specifically and effectively. Now, the theory behind it is that all your organs should be able to move freely. They should be able to slip and slide on each other. If our organs are able to move freely, then they're able to function at their best. What happens is that anytime we get inflammation in any of our organs, as it's going through the healing phase, it'll actually adhere to the tissues around it and put those organs into a rigid state. And when it's in that rigid state, it really affects the effectiveness of how that organ functions, but it will also affect blood flow, lymphatic drainage, nerve conduction of that organ. Now, how it gets inflamed can be from a number of things. So it can be from surgery, injuries, it can be from food intolerances, it can be from chronic infections in the body, it can be from heavy metal toxicity, environmental toxins, and it can also even be from emotional conflicts that can affect specific organs and cause inflammation in the area. Now, I want to just give you an example of what can happen is that a patient can come into the clinic and they will present with neck pain and mid-back pain and some shoulder mobility problems. And when we continue our history and find out more about their story, we find out that they've actually had a history of lung infections and colds and viruses that have affected their lungs over the years. Now, what happens is that when they have those infections and then the lungs are healing after those infections, then as they heal, they adhere to the tissues around them, and it puts those organs into a rigid state. And they'll adhere to, for the lungs, they're going to be adhering to the rib cage, to the spine, to the shoulder blade. And when this happens, it can actually cause restrictions in the structural part of the body, and it can be pulling these structures in the wrong directions and affecting really how those structures are supposed to be moving, which can thus cause pain. And so by doing some visceral manipulation on a patient like this, by releasing the lungs and getting the lungs to move better, and by doing this, we release some of the restrictions to the ribs, to the spine, to the shoulder blade. And when we do this, we actually help the lung to function better. And we also relieve some of those pain aspects in terms of the spine, the neck, and the shoulder. So this is just an example of how just a small change can cause a multitude of imbalances in the body. And by simply doing some visceral manipulation, getting those lungs moving, then we can actually really improve the health of our patients. So thank you so much for watching. I hope you learned a little bit more about visceral manipulation and how it may be able to help you. So please share this with your friends. Press the like button, make a comment below, and until next time, continue to learn, grow, and build health.